Good evening, ladies and gentlemen. Welcome to the special session on breast cancer. Special because we would like all the youngsters out there to be better informed. As we all know, early detection is the key to prevention. This campaign is brought to you by DH Brandspot in association with Manipal Hospitals. We are joined by medical experts who will share with us their experience and information about breast cancer and help us understand to overcome this. Study states that breast cancer accounts for 14% of cancers among Indian women. Earlier, uh, cancer was diagnosed in women who were in their 50s and 60s, whereas now, with the rapid changes in lifestyle and other factors, youngsters are also diagnosed with breast cancer. But what do we mean by breast cancer awareness? It is an effort to raise awareness and reduce the fear of breast cancer through education on symptoms, treatment, and changes in lifestyle. To know more about the causes, symptoms, and early detection among youngsters, please welcome our specialist from Manipal Hospitals. Joining us today, we have Dr. Somashekhar, Chairman, HOD, and Consultant of the Department of Surgical Oncology and Gynec Oncology and Robotic Surgery at Manipal Hospitals, Bangalore. Welcome, Doctor. Our next specialist for today is Dr. Poonam Patil. She has more than 22 years of experience in treating solid organ cancers like breast, lung, gastrointestinal, gynecologic, head and neck cancers. Good evening, Doctor. Also joining us today from Manipal Hospitals, Bangalore is Dr. Ashok, an expert in plastic reconstructive onco and cosmetic surgery. He specializes in breast reconstruction and aesthetic surgery. Good evening, Doctor. And our final specialist for the day is Dr. Rupa Ananthasivan. Dr. Rupa is a consultant radiologist at Manipal Hospitals, Bangalore, specializing in women's imaging, particularly breast imaging. Her assessment in screening breast cancer and breast lump is commendable. Welcome, doctors, to this wonderful session. Before we get started, we have a live audience joining us on Deccan Herald Facebook and YouTube channel. So we will be taking questions from the audience as well. So send us your questions in the comment section on Deccan Herald, YouTube, and Facebook. A warm welcome to the live audience and to our doctors. So let us start the session with Dr. Poonam. Dr. Poonam, today, a study states that 50% of women under the age of 50 are diagnosed with breast cancer, especially in the Indian subcontinent and in Southeast Asia. That is a pretty alarming statement and a study which has come up. So in that note, why is the breast as an organ considered to be more prevalent for cancer?
Breast cancer is very dependent on presence of hormones in the woman's body. And increasing age is a very important risk factor for breast cancer. So as the age increases, the incidence of breast cancer also increases. And as we are all going to age, breast as an organ in females is most affected with increasing age.
Okay, but among youngsters, I mean, how would you say that, for a youngster, a young Indian woman, how does it, consider to be a very prevalent issue for cancer?
So there is a price that we are paying for the lifestyle. So one, of course, that the awareness has increased thanks to people like you who are increasing the awareness of breast cancer. And younger women also now know about breast cancer. They are trying to see how they can diagnose it early, how they can reduce the risk, what all can they do to prevent it. But also the lifestyle which we are leading today is definitely something to be worried about, and it definitely needs to be worked on.
True, doctor. Yes, well said on that. What are the signs and symptoms of breast cancer? I mean, how should, or when a young woman is, looking out for it? So, what should she, look out for when it is under the breast cancer?
Yeah. So most of the times, breast cancer presents as a painless lump in the breast, or sometimes even towards the underarms region, what we call as the tail of the breast. Other symptoms that can occur of breast cancer are spontaneous blood stain discharge from the nipple. Sometimes there is inversion of nipple. Sometimes there is dimpling or indrawing of the skin of the breast, change in contour or size of the breast, change in texture of the skin of the nipple or areola. Areola is the dark color skin that is present around the nipple. Sometimes the texture of that area changes, and rarely it may present as if there is some infection in the breast. It may be a swollen breast, or it may have red discoloration, what we call as inflammatory breast cancer. So these are the common signs and symptoms, but very important to remember that it is most often beginning as a painless lump. And many women ignore the lump because they feel that there is no pain. So why should I visit the doctor right now? And that's the point where we miss the bus early.
Understood, doctor. Yes. So now moving on to this, with this same question, Dr. Rupa, as a radiologist, on a daily basis, you come across a lot of women, especially young and old. So in that sense, what is the diagnostic tool to confirm breast cancer?
The gold standard for evaluating the breast, particularly for breast cancer, is mammography still. Okay, we usually start a mammography if the patient is above the age of 35 or 40 and they come to us with a lump. A younger woman, we would actually start with a breast ultrasound, because sometimes younger women will require a breast ultrasound and a mammogram. So we will have some suggestion whether this lady has a problem or not with the mammogram, or the mammogram and the ultrasound together. We will definitely have an idea whether this patient has a problem or not. But the final diagnosis would actually be a biopsy, where we would put in a small needle in the area where we find a suspicious abnormality. We would take out a little bit of tissue and give that for examination under a microscopy, and that will tell us whether this abnormality, this lump or whatever we are seeing in the breast, is cancer or not. So that's the final diagnosis. The pathology is the final diagnosis.
Okay. But that sounds like a very painful procedure, doctor. I mean, whenever you say biopsy, when you say you're trying to prick at that particular point, how painful is it? And, will everybody be able to withstand, or is it done, in a different process? If you can just throw some light on that.
Yeah, it sounds more painful than it actually is. I know the breast is a very sensitive organ. And I actually want to say that a lot of the breast biopsies which I do in my department, are actually benign breast biopsies. Okay, there is a lump. It doesn't look too suspicious, but sometimes on mammography and ultrasound, we are not able to say 100% whether this is a benign lump and it's not cancer. So that's why we ask for a biopsy. So I want to very, very specifically tell people that just because a radiologist or a surgeon or an oncologist asks for a biopsy of the breast, that doesn't mean you have cancer. They actually want to rule out cancer. So the good number of biopsies are actually benign. Up to 70%, especially in younger women, are actually benign biopsies. Okay. But so it's usually done, it's done in a sterile environment, because we don't want to introduce infection. We give a little bit of local anesthesia over the skin. So actually that's the only painful part. And actually it's only the skin of the breast which is painful. The breast tissue per se is not painful. So we give a little bit of local anesthesia in the skin that numbs the skin, which lasts for about 10 to 15 minutes. We finish the biopsy, and even after that, they're actually quite okay. Most of them go home. We just give them a small painkiller. And actually, I usually tell them it's not any more painful than a dental treatment you've done. The dental treatment, it starts a little bit of stinging. You have a little bit pain while they give you the local anesthesia, and then you're quite numb. You don't know what's happening afterwards. So though it sounds a little painful, actually it's very, very tolerable. It just has to be done in a specialized area. And that's why we call them to hospital and make them, we do it under ultrasound guidance, particularly the small lumps, so that we make sure we get the correct area. So it's easy, tolerable. People are more afraid of the result. They're a little afraid of the pain. So everything makes them very anxious, but it's a very tolerable and easy procedure to undergo.
That is really very reassuring, Dr. Rupa. And also, when a young woman is about to start a family, with a history of cancer in the family, would you suggest that she gets assessed before starting a family, before she starts, getting into the family way?
No, I don't think it's the family way which is important. More important is the family history. Okay, so it's not going into pregnancy. It is an age which is important. Okay, so
Okay.
if a young woman has a strong family history of breast cancer, or other cancers in the family, including ovarian cancer, uterine cancer, and even prostate cancer in a male relative, particularly it's a very close relative, ideally they have to get assessed in a genetic setup. So they will do a sort of family tree and will give them the degree of the risk of them developing a breast cancer or ovarian cancer or uterine cancer, whatever. And that is what we take forward. Generally, what we do is we start screening for them 10 years prior to the closest relative who had a breast cancer. So if they had a mother, or her mother had breast cancer, say at about 38, we would probably screen this lady from the age of 28 or at least 30. So, I mean, it's a good idea to do that before trying for a family, but it's very important to keep that age of 10 years prior to the index case. That is most important. So even if not starting for a family, they should not forget to start testing themselves and get hospital support 10 years prior to the close relatives incidence of breast cancer.
Okay, okay. Now moving to Dr. Poonam, with regards to India, I mean, how commonly is it diagnosed at an early stage? You know, as Dr. Rupa mentioned that, like, you know, at the young age of screening, you know, 10 years prior to the age. So how commonly is it diagnosed at an early stage? And have you been noticing that, you know, youngsters have been coming forward to get themselves diagnosed? Dr. Rupa, you're on mute.
So can you hear me now? Yeah.
Yes, doctor.
So it's generally rare before 20 years of age, but beyond 30 years, we see that there are women who come with breast cancer. By age of 30, it's almost 1 in 2,500 women who may be diagnosed to have breast cancer. By age of 40, it is 1 out of 200. By age of 50, it's 1 out of 50. So that's how, as the age increases, the incidence increases. But we do see women who are in their 30s, even early 30s or late 20s, who are coming with diagnosis of breast cancer.
Okay, okay, doctor. Yes, we got the details on that. Moving on to Dr. Somashekhar. Doctor, you come across many cases of breast cancers, you know, in women, whether they are young or old, like, you know, quite a lot of cases, you know, where they are unmarried as well. And we see that a lot of young Indian women are prone to, you know, illnesses, quite a lot of illnesses. So how common is breast cancer among Indian women and how fatal is it?
Yeah, you know, in worldwide, the #1 cancer is the breast cancer.
Oh.
But, you know, we have to understand the way an Indian breast cancer is totally different than the Western world. #1, usually breast cancer is more common in 5th decade abroad. But in India, it is 1 decade early, 10 years. So it has moved somewhere around 40 years. Of late, we have seen most of the women between 35 to 40 coming. India is a house for the largest volume of young women cancer who are between 30 to 40. #2, abroad in the Western world, if you have a breast cancer, if you take across all the group, the chance of cure is 95%. But in India, it is only 50%. Third, Indian women breasts are dense, so very difficult to evaluate by mammography and we can miss the cancers. #3, every year, 3% there is an increase in the breast cancer incidence in India. And only less than 1% women in India undergo breast screening. So if you couple all of them, here is a disease which is highly amenable for cure, highly amenable for simple screening once a year. It takes 30 minutes to screen the breast, clinical breast examination or breast self-examination or memo. And by rule, 95 to 99 women should be cured. Unfortunately, with the scenario we have, young women, no screening, 70% in India coming in advanced stage, and no, outcome is poor. So unfortunately, a curable disease because of lack of awareness, lack of screening, young women, we are losing 50%. 1 out of 2 women we lose every 5 years In India, it is postulated every hour there is one woman diagnosed with breast cancer. So this is very unfortunate, and this statistics which are not favorable. You know what is the worst part? Highest incidence of breast cancer in world globe comes from Western world.
Oh.
We are rising, but not the number one. But highest mortality and death because of breast cancer come from India. Very sad. We are not the number one incidence, but number one in deaths. So it's very sad, and that's why awareness meetings like this to general public important to break this and give 95% cure to our women, so they don't come in advanced and they retain the breast.
True, doctor. Yes, that's a really very important information which you have shared. Now, once a young woman is diagnosed with cancer, the next step always, what comes into anybody's mind is a surgery to be undergone. So do you say that every cancer which is detected, is the first line of treatment going to be a surgery to be undergone?
Now, when a young woman comes with breast cancer, we need to make sure it is not hereditary breast cancer, because, we have a gene which causes breast cancer and ovary in their mother, patient sister, siblings and all. So once we rule out it is not because of hereditary genetic cause, then the current treatment of cancer is not just stage based. Now, this is not an era of organ ablation. In cancer, now this is an era of not maximum tolerable treatment, but minimum effective treatment with breast preservation, maintaining full life, quality of life and cosmesis. So now this is an era of genomic analysis. We as a surgeon, with the help of Dr. Rupa and intervention radiology, we do a fine thin core on outpatient. We do a genetic test of the tumor, which takes about 72 hours, called as IHC4 test. This will decide what is the genetic make of that cancer in that young woman. That will decide she directly needs a breast preserving surgery or she needs a chemo or tablet to shrink and do. So in nutshell, all women who come doesn't undergo surgery straight away. It is based on the genomic profile. About 30% of women undergo surgery upfront, followed by chemo or hormone. Remaining undergo some form of treatment with help of medical oncologist like Dr. Poonam, then still undergo a curative breast preserving surgery.
Okay, so you mean to say that, yes, it's like, the breast can also be like, retained, and a different type of, treatment is followed, right? In the line of treatment, it is always never the old school of thought that it is always a surgery which has to be performed. Correct, doctor?
No. Absolutely. See, through you with this media, I want to convey something to all the listeners. Number one, breast cancer doesn't mean loss of breast.
Correct.
In my institution, 90% is the breast preserving rate for a woman coming with breast cancer. In India, as per the Globocon data on National Cancer Registry, 60% is the breast conservation in all setup, government, rural, corporate, private, which means the rule in breast cancer is breast preservation. So please don't be afraid. Breast cancer means remove. No. Second, whether we remove the breast, which we call mastectomy, or we remove the breast cancer lump, retain the breast, which we call breast conservation, both of them have same cure rate. Retaining and preserving breast is not inferior to removing the breast. So please don't force your doctor to remove the breast unnecessarily. Yeah. Cure rates are same. So, and you're going to live lifelong. Cosmesis also is important.
Understood, doctor. Really, a very informative, information, especially for the youngsters who have been like, under the fear, or even women, not only youngsters as such. There's always a fear, as when you say surgery. Now, let's say you have removed the, the lump, or the surgery is done in a case where a young woman has to undergo. So after the surgery, is it required to maintain, a normal lifestyle, or is there a specific lifestyle which has to be followed by youngsters or even older women?
Number one, we always tell, we treat you to put you back to society to do what you do the best. If you're a professional, no change. You're a trucker, go ahead. If you're a traveling person, journalist, or an active athlete, please continue your lifestyle. Do what you are doing, no inhibition or restriction. However, there are most important, there is something called as PLCO study, which is done, which shows a woman who is a breast cancer graduate survivor, if she does 20 minutes of good exercise, treadmill or a brisk walking, physical activity, yoga, maintains 1 serving of salads of fresh vegetables, 1 serving of plate of fruits, keeps her body mass low. If you go to Google, you put your height and then you put your age, it will tell for your height, weight, sex, what is the ideal weight. Please keep 2-3 kilo less than that. Not putting on weight, low on fat meal, no need to stop, and having positive attitude and high fiber diet. If you do all 5 I told, the chance of breast recurrence is proved to be less. So the only thing we want you to change is professional life, same, family life, same, personal life, same, modifying lifestyle, what I told, please do it. This is all what we recommend.
That's a very informative session what Dr. Somashekhar has given. I hope all our viewers and audiences have taken this point into consideration and look at your lifestyle, your eating habits, as doctor says, have fresh vegetables and fruits, to improve a better and a healthier life. Now moving on to Dr. Ashok. Dr. Ashok, we understand with today's technology, and it is such an advanced stage that breast reconstruction is not a difficult procedure. So could you tell us who should consider breast reconstruction surgery, and what are the different types of reconstruction procedures which are available? Dr. Ashok, you have to unmute.
Yeah. So anybody who is fit for surgery and who wishes to have reconstruction done, they are the candidates. There is no age restriction. There is no size or shape or the kind of resection or the kind of cancer surgery they do doesn't limit the reconstruction options at all. So anybody who is fit and is willing to undergo this surgery, who wants the breast to be reconstructed, they are the candidates for reconstruction. Now, reconstructions are done, as Dr. Som said, you don't need to do total mastectomy for most of the cancers now, as in our institute, about 90% of them are called breast conservation surgeries. And from them, we do something called an oncoplasty, where we readjust the remaining breast, or we borrow little tissue from the side of the breast, and we fill the cavity that is left behind by removing the tumor. This is called oncoplasty. It's a simple day care procedure. Patients come in the morning, they go home in the evening. They carry 1 or 2 small tubes, but they get it removed in the second, third day. It's as simple as that. So this is called oncoplastic reconstruction of the breast. Women who undergo complete breast resections, that is mastectomy, for them, there are 2 ways to reconstruct them. We can use artificial material, like we use silicone prosthesis. Patients who doesn't want longer surgeries, patients who are not fit for longer surgeries, we can use implant-based reconstruction. However, they themselves carry some of disadvantages of having a foreign material inside the body, and they have to be replaced every 10 years. And also there is a small risk now that some of these implants themselves may produce secondary cancers. So there is a small fear. However, it is very, very small. And that's the reason it has taken a backseat. The autologous reconstruction, what we call, we borrow tissue from somewhere else in the body and we create complete breast. And that is patient's own tissue. It survives longer. It behaves like breast. It ages like other breast, and the patient also feel it is a part of them. It's nothing something which is foreign material inside sitting and all. And they can also undergo radiation and chemotherapy when we do this kind of reconstruction very, very safely.
Okay. And further to the reconstruction, doctor, now once a patient has undergone removal of the lump, so after how long should the patient wait for a reconstruction to be done, with an implantation? And will that be a temporary or a permanent solution when the patient is undergoing a reconstruction of the breast?
So most of the time when somebody comes diagnosed with breast cancer, right? So they have the fear of cancer, and lots of them don't want reconstruction at the time. They want the cancer to be removed, and it goes out of the body, they feel very, very good. So in our institute, as aptly it is called comprehensive cancer care center, we call it. We all sit together, we all talk to the patient in terms of what needs to be done, what is possible, and we leave that decision to be made by the patient themselves after giving all the information to them. So the reconstruction can be done at the time of removing the breast. It is called immediate reconstruction. The advantage of that is that in one go, with one anesthesia, with one hospitalization, patient's breast, the cancer is removed and the reconstruction is done. And they don't feel the loss of the breast at all. They don't feel they are inadequate in any way. Psychologically, they are not affected. So that's the advantage of doing immediate breast reconstruction.
Okay.
For some reason, either economical or their fear or psychological, whatever reason, they don't want reconstruction to be done at the time of mastectomy. We can always do it once they finish the chemo and radiation. That's called secondary reconstruction. There is not too much of difference in the outcomes, just that the patient has to undergo one more set of hospitalization and surgery. So that's the disadvantage of doing a secondary reconstruction or a delayed reconstruction, as we call it.
Okay. Doctor, further to this question, we have a question from one of our audience, Mr. Pramod. His question is it a very expensive procedure, and what will be the cost, given the current advancement in the technology? How expensive would the procedure cost?
See, in our hospital, most of the time, first of all, it is covered under insurance. If a woman, though it is not an essential reconstruction in terms of life preservation, but the insurance people have to cover this. That's the order from the government of India, and all the breast reconstructions are covered under insurance. And it is affordable to most people. And there are some support groups, patients who cannot afford reconstruction and cancer surgeries. There are support groups who come in and pitch in and help them to circumvent these problems. So I don't think cost should be an issue with these kind of surgeries at all. It is just the mindset.
Okay, doctor. Thank you. I hope, Mr. Pramod, you have listened to Dr. Ashok on this, and we hope that you have got the information. Now, moving on to Dr. Rupa. Dr. Rupa, when a person gets an X-ray, usually they're exposed to a certain amount of radiation. So similarly, when a woman comes, to get a mammogram done, when she's exposed to radiation, now whether there's a lump detected or not, or whether it's a cancerous lump or not, is the patient, when the patient is exposed to that amount of radiation, can that radiation or give a side effect and cause cancer? Is that a possibility?
That's a very good question. If you ask me, is it a possibility? It is a possibility, but it's a very, 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 very remote possibility. Okay. The idea is you always have to keep radiation as low as possible, because even the lowest radiation can produce a change in the cells, which can ultimately result in some sort of a cancer. Okay. But these are all theoretical. These are all, there's never been a proved breast cancer because of radiation. Okay, these are all theoretical prognostications, which are actually have come after the atom bomb in Nagasaki and Hiroshima. So these are all theoretical considerations. Okay, so but still the dictum for any radiologist is to keep the radiation as low as reasonably achievable. Okay, so the benefit a person, particularly with a symptom which may be a breast cancer, will get by that small radiation of mammogram is tremendous. So there's no comparison. So you will have to do the radiation in that case. Even women who do not have breast cancer and are coming for what we call screening, we encourage all women above the age of 40 to come once a year or at least once in 2 years for a screening mammogram. Okay, even the radiation which they get is the benefit they will get about picking up a breast cancer is far, far, far higher than the theoretical risk of them ever getting an abnormality or breast cancer for that matter because of the radiation. You understand? So the risk-benefit ratio is so vast that the benefit is much, it exceeds the small risk you're taking. So it's like having a car in Bangalore, okay? You drive a car because you have so many benefits. Isn't there a theoretical risk? Isn't there a risk that you will have an accident? There is, isn't it? But the benefits of you having your own vehicle is so much higher that you will use it, but you will use it in a very prudent way. You will use it following certain rules and regulations. So that's the benefit of doing an X-ray or a CT or a mammogram in any disease, particularly if it has been asked for by a doctor, because they know the benefit far outweighs the theoretical risk of some problem because of that radiation. And actually a mammogram, the radiation you get is the same as a dental X-ray. People even don't ask you, can you take a dental X-ray? It's the same as that. It's the same radiation you get actually if you travel to the US 4 times a year. One mammogram is the same radiation you will get because of the ultraviolet radiations if you travel to US 4 times a year. It is the same radiation that some people who live in parts of Kerala get because of the background radiation. You understand? So the radiation is very little, and if it's used prudently, it will never harm you. It's as simple as that.
Okay, oh, that was well explained, doctor, on this particular radiation topic. Now, when we say prevention is always a better tool, what will be your recommendation as an investigation tool?
So really, sometimes we can't prevent cancers, but as Somashekhar says, there are some lifestyle modifications which are good throughout. See, it prevents a lot of cancers. You understand? There's no study which says that, if you live this lifestyle, you will never get a cancer. No, but the faxing of keeping your weight down, regular physical activity, less of processed foods, less of saturated fats, more of fiber, less, no smoking, alcohol intake as low as possible, or having, and actually among women, having your children early, having them when you're less than 25 is a bit difficult, but at least less than 30. Breastfeeding your children the way our mothers used to live, okay? You live that sort of a lifestyle, your chance not only for breast cancer, but a lot of other cancers, including colonic cancer, is actually quite low. So there's but doesn't mean that every person who lives this will not get cancer, but the rate, the incidence will be less. So we really can't always prevent cancers, but what we would like you to do for breast cancer is pick it up early. As Somashekhar said, we can cure you 100% if you come to us early. So Dr. Poonam has described all the signs: a painless lump in the breast, in the armpit, unusual nipple discharge, changes in the skin, changes in the nipple. You see that, come to us immediately. If you have a strong family history, start getting screened very early. Come to one of us, we'll tell you what to do. If you don't, even if you don't have family history, try to do a regular breast self-examination every month. You can just Google it on thing and look for breast self-examination. It tells you how to do it. Come for regular health checks after the age of 30. Let a doctor or a nursing practitioner examine your breasts looking for small lumps. If you're above the age of 40, please come for a mammogram once a year or once in 2 years. You can have self-referral. You can just come in for a mammogram with a self-referral. If you've not done one in the last 1 year, we can automatically do for you. This will help us pick up the early breast cancers, and we can give you 100% cure.
Got it. Yes. So that is, something which everybody, whether it is young or old, should keep regularly screening and
watch out for the early signs of breast cancer. Be aware. Be breast cancer aware. That's very important.
Correct, doctor. Viewers and listeners, we are, live, and we would like you to post your questions and your comments. So please do post your questions on Deccan Health Facebook and YouTube, and the doctors are there to give you all the information on the causes, symptoms, and treatment, and everything is explained very clearly by each and every doctor. So kindly post your comments, and we will take it forward from there. Dr. Somashekhar, coming back to you, when we talk about surgeries, after surgery, after recurrence, how often do you see a recurrence among young women once a cycle is completed? You've treated them, they've undergone chemotherapy and radiation. How often do you see a recurrence among young Indian women?
Luckily, breast cancer is one among a very good cancer where survival is not, spoken in terms of 5 year, but 10 year. We have a rule that, all public know cancer means 4 stage, 5 year cure. But breast cancer is one of the rare cancer, important cancer where 10-year cure is spoken to let them know it is a very good cancer to have a amenable curative treatment. So the recurrence in breast cancer is not common like it is there in lung cancer, pancreatic cancer. Having said that, there are some factors which has more chance of coming back who needs a good follow-up. Who? Younger the woman at the first stage she had breast cancer, the recurrence is little more. A woman who had both breast cancer at presentation, little more chance. If they have a familial history, like mother had a cancer, they have a gene, father had a prostate cancer or a ovary cancer, then they can have a recurrence in the same breast or new in the other breast and ovary. And then there is a genetic make where we call something called as triple negative, which is not hormone dependent cancer. Most of the breast cancer are hormone dependent. If it is a non-hormone dependent, they have little more chance, and BRCA mutations have higher chance. And the stage at which they come to the doctor, stage 1, 99% cure, less than 1% recurs. Stage 3, 75% cure, 25% it comes back. So these are the factors a woman needs to see. Young woman, little higher chance. Familial history, BRCA, look your ovaries and other breast. If you come late, you retain little chance. Having said that, even the most advanced stage 3 cancer are curable today with the fantastic immunotherapy, targeted therapy, hormone therapy available with medical oncologists. And things are going into genomic and genomic level. A lot of medicine based on personalized medicine are available, but cancers do recur. It may be in the operated area or in the armpit or outside. So don't miss a follow-up. The right follow-up is you are cured of cancer. First 3 year, 3 monthly, go and get checked with your doctor. Once you complete 3 year, you're already good. 6 monthly, twice a year, you meet your doctor. After your 5 year, chance is very low. Once a year, you meet your doctor.
Okay. Oh, that was well explained, Doctor. Thank you on that. Now, moving on to Dr. Ashok. Doctor, what is breast cancer related lymphedema? How to prevent it? And is there a treatment for that kind of issue? Doctor, you're on mute.
Yeah. So breast cancer related lymphedema is a kind of necessary evil that happens in women who undergo axillary node dissections. So to prevent the spread of a disease, the cancer surgeons remove lymph nodes from the axilla or the armpit. So unfortunately, these armpits also drain the upper limb. The lymph, what we call, also from the upper limb is also draining through these lymph nodes. Once we remove these lymph nodes, there is no place for this lymph to go from the arm. So slowly and steadily, what happens is that the lymph, it's a water-filled or a proteinaceous water, which is in between the cells, it starts accumulating. And the lymph starts growing bigger and bigger and bigger. It becomes painful, it becomes heavy, and socially they're embarrassed. The cloth won't fit them. And the biggest and the most threatening part is they get repeated infection in these limbs because there is nice, good media for the organisms or the bacteria to grow. And sometimes it is the infection itself is fatal. So sepsis is a quite common, dreadful condition that can happen. So lymphedema will happen in between 30 to 60% of women who undergo axillary dissection, the removal of lymph nodes. And it increases further if they give radiation to that area. So in the first 5 years, we notice between 30 to 60% of women will develop lymphedema. Is there a cure? First of all, there is something, a prevention. There are steps to prevent it from happening at all. Like in our institute, Dr. Somashekhar does something called a sentinel node biopsy. This is one of the few centers where we do this. Instead of removing all the lymph nodes, with a special technique, Dr. Somashekhar removes only the lymph node most likely to be affected by the cancer. Only if it is affected, then they go and remove the rest of the lymph nodes. If that is not affected, there is a 99% chance the other lymph nodes not affected, so the lymphedema doesn't occur at all. So that's one way to look at it. So second way, by doing some plastic surgical procedures. So once they remove the lymph nodes, there are cut ends of this lymphatic. Lymphatics are like blood vessels, but they don't carry blood, they carry lymph. Lymph is nothing but just blood without the blood cells. There is no red blood cells or white blood cells. The fluid part of it is going as lymph. So these cut lymphatics, what we do is we find them under high power magnification or microscope, and we find veins in the axilla or the armpit, and we bypass directly into the veins. So the lymph drains into these veins, and there is the chances of lymphedema developing in such people is very, very less. This is a new technique and new procedure that we do it in Manipal Hospital now for the last 2-3 years. And it has given fantastic results. So this is about preventing. And also, as you were telling, there is lifestyle changes you need to do. Couple of things: exercise and wearing a compression garment. It's an elastic garment we allow women to wear after axillary dissection. So they wear it in the daytime or the nighttime, 12 hours. So it does increase the compression pressure in the arm and allows or facilitate the lymph to flow into the normal pathway. So this is all about prevention. But if a woman comes with already established lymphedema, again, there are two ways to do it. We can borrow lymph nodes from somewhere else in the body, and we can replace the removed lymph nodes. It's called vascularized lymph node transfer. And we can do bypasses as we do at the time of surgery itself. We can also do bypasses later on, just to prevent or drain out all the excess fluid that has collected. So these two are very specialized procedures. Very few centers in India does it. But if you do that, the lymphedema is almost curable. 95% of the volume, everything will go away, and patients will get benefited from that.
Understood. Thank you, Doctor, on that. Moving on to Dr. Poonam. Dr. Poonam, in case a woman is diagnosed with breast cancer, she's completed her entire set of treatment. Now, in case if there is a relapse of the cancer, what medical regime would you advise? Would you follow the similar regime what was followed in her previous treatment, or would you follow a different medical regime for a young woman?
Okay. So it actually depends on the time lapsed from the completion of first regime of chemotherapy, whatever the lady had got. It depends on the type of recurrence, whether it is hormone receptor positive or negative, whether it's HER2 positive or negative, because the drugs depend on that. It depends on the drugs given in the previous chemotherapy regimen, because some drugs have a lifetime dosage, and if it is already exhausted, we cannot use those drugs again. So many times we don't repeat the same regimen if the occurrence has occurred within a few months after completing the first regime, because it obviously means that the cancer cells are unlikely to respond to the same regimen. So there are many things on which we decide what treatment to choose. And if possible, then whenever there's a recurrence, we try to do a biopsy to know what is the receptor status, so that whatever treatment we are giving would be a true treatment based on her characteristics of the tumor.
Okay. Doctor, when we talk about the relapse, let's say, the woman was diagnosed in her right breast. So when there's a relapse, could the cancer again, relapse in the same right breast or a left breast, or, could it spread anywhere else? I mean, is that a very common thing, or will it occur in the same place?
No. So there are two types of relapses. One is a local recurrence. Second is a systemic recurrence or a distant recurrence. Loco-regional recurrences when there is recurrence in the breast and the underarms. Local recurrence when there is a recurrence only in the breast. And distant recurrence could be anywhere from head to toe. It can come anywhere in the body. But most common organs that can get affected are the liver, bones, lymph nodes, lungs. These are most common organs. But certain types of cancers, such as HER2 positive breast cancers, triple negative breast cancers, can also spread to the brain. Not that other types don't spread to the brain, but it's more commonly seen with triple negative and HER2 positive breast cancers.
Okay. So moving on with this, there is one particular question which I would like to ask all doctors here. A one-line advice to the youngsters on this occasion about breast cancer and better living. Dr. Somashekhar, I would like you to go first and give a one-line advice to the youngsters on this occasion, please.
Remember, what the mind doesn't know, eye cannot see. So it is very important for yourself to be convinced cancer is not something, a curse or a death sentence. It is highly curable. In fact, nowadays, cancer is more curable than normal kidney diseases. So on all your important days, like your birthday, please ask your mother, your wife, your sister, did you gift a breast cancer screening package to them? Once a year takes 30 to 40 minutes, few hundred rupees. That is the best gift you can give to your loved woman in your life in any form, mother, sister, wife, husband, anybody, to save their life so they can save you and educate you.
True, doctor. Family comes first, always. That is true. Dr. Ashok, what would you advise our youngsters today?
See, cancer is fear, right? So don't get afraid of this. It is highly curable disease, and regular follow-up or regular screening is what you should do to really beat this disease. It's as simple as that. Don't be afraid. Go to the nearest doctor, do breast self-examination, and you are quite safe about it.
Okay. Now we have a question coming in from Mr. Naveen Andrade. He says, women have a tendency to not visit a male doctor for examination related to their breast. How can we convince them or get them out of the stigma they have? I would like to ask, probably Dr. Somashekhar to answer this.
Yeah.
Okay, I'll repeat the question.
I agree with you. I understood it. I would not say you forced to go to a male doctor. It just doesn't matter. You can go to any doctor. There are very good surgeons, lady surgeons. Every department, including our department, has a lot of ladies who are good surgeons. Treatment is not about gender. I think most of the people doesn't know the most successful obstetrician in the world are males, not ladies. Then comes the lady. So this is not a area about that particular, but always go to the place where you are most comfortable. If you are comfortable, I would always tell a woman with breast examination coming to me that they can be comfortable with me or with my colleague doctor who is a lady doctor being with me. Please go where you are comfortable. Just because you need to meet a non-lady doctor, with that fear, don't avoid a screening. India is a very, very good 45% of surgeons in India now are taken up by ladies. Everybody is equally good. So there is no obligation. Please go anywhere. Having said that, this is not a place where gender plays a role. It is a good doctor, good relation with you and them matters. And always remember, your husband is also a male and not a lady.
True, Mr. Somashekhar. True, very true. Well said on that. Mr. Naveen, so I hope that stigma is...
Can I make a statement? Sorry, can I make a statement?
Sure,
I just like to tell this thing. Even today, mammography all over the world is still done by lady technicians, okay? Even in the Western countries, because it's a very personalized sort of this thing where, they actually manipulate the breast. So please do not worry about getting your breast examined during mammography that there will be a male technician. All over the world, female technicians still do mammographies regularly. So please do not worry about that. Please get your screening mammograms done at regular intervals. I always say breasts are like husbands. They have to be checked regularly. So please get your mammograms done regularly. They'll always be done by a lady technician. Okay, so don't worry about that. Okay.
Oh, wonderfully said, Dr. Rupa. That is really very sweet. So what will be your one-line advice to the youngsters, Dr. Rupa?
Breasts are like husbands. Please check them regularly.
Okay. Dr. Poonam, what will be your one-line advice to our youngsters?
Be aware of your own body.
Understood. Yes.
Notice the changes. Body does keep giving us signals, which we in our busy life tend to overlook many times.
Understood. So I hope, Mr. Naveen, you have your answer there, and please, remove the thought of any kind of stigma. So it's the family which has to come first, and doctors are all there to take good care of you all, to help you all through this process. And I know we should bring the, get the fear out of us and just go to them, and they are there to help us through and through. So next, we have, Mr. Pramod, who's, asking us, what are the tests a woman can do to detect early breast cancer? Maybe not visiting a doctor. Before visiting a doctor, is there a self-examination which can be done, and how to help them to do the self-examination? Dr. Poonam, if you can, probably tell Mr. Pramod on that.
Yeah, so breast self-examination actually starts at around 20 years of age, and monthly every woman or every girl should start examining the breast. And if you start examining it regularly in the first week after periods, that's the time when the breast tissue is more supple and not as painful. Sometimes there is pain before the periods. So after about a week of periods, you should monthly examine your breast. There are various ways of doing breast self-examination, as Dr. Rupa said earlier, that if you go into the internet and you search for breast self-examination in almost all languages, you will find how to do a good breast examination. So if you start at early age, you know what is normal for you, and hence you can pick up an abnormality much earlier. And you have your health in your hands. You can find out what is normal, what is not normal. You know something that is persisting for months together or years together, that's something very normal and a part of your body. But something that was not seen earlier and has cropped up recently and is probably worsening with time, that should raise an alarm, and you should immediately check with your doctor. It's very possible that it may be a benign change, as Dr. Rupa also said earlier. But if you should not miss out on a malignant tumor.
Okay. Oh, that was wonderfully explained, Doctor. Now, we have come to the end of a session for today. Like we discussed, awareness causes people to identify their lifestyle and follow effective changes for a better and healthier future. This session has given us an insight to breast cancer among youngsters, importance of early detection and being aware of one's body and going for regular tests and screenings. Prepares us for a safe and healthy future. Moving forward, let us not fear breast cancer, but be aware and bring our health and family first, especially our youngsters. Thank you, viewers, for joining us. I would like to thank the doctors from Manipal Hospital for sharing their views on breast cancer awareness. Thank you, doctors, for this wonderful evening. I think every question, what we put out and what even the viewers wanted to know have been very beautifully explained. And thank you so much for your time, sharing your views and your information on this. So really, thank you. Have a wonderful evening and stay safe.
Thank you very much.
Thank you.
Thank you.